Good day, everyone. My name is Rebecca Lilly for the International Association for Energy Economics. It gives me great pleasure to welcome you to today's webinar entitled Coal Decline and Opioid Overdoses, Need for Just Energy Transition. We are grateful to our speaker, Zhen Lei, for today's timely discussion, and note that first, a little bit about the International Association for Energy Economics. We are the largest association specializing in the field of energy economics and provide a forum for the exchange of ideas, experience, and issues among professionals interested in the field. The organization produces 2 professional journals, a newsletter, and holds conferences and virtual presentations along with a host of other products and services that you can find at our website at www.iaee.org. If you're not already a member of the association, we welcome you to join. A few housekeeping matters in regard to today's webinar before I hand things over to our speaker. First, this webinar is being recorded for those that cannot participate in today's live event. If you have questions for our speaker, please click the Q&A button at the bottom of the Zoom window and type your question. We've allocated time at the end of the webinar to address your questions. And now I would like to introduce you to our speaker, Zhen Lei, Associate Professor of Energy and Environmental Economics at Pennsylvania State University in the US. Zhen, over to you.
Okay, thanks, Rebecca, for this opportunity to talk about this research on behalf of my co-authors. So we know that we are in a process of energy transition. So we away from the fossil fuel and to renewables, but there will be winners and losers. So particularly the energy transition will already have some negative impact on those communities that are reliant on the fossil fuel. Which highlights the importance of a just energy transition. So I'm going to talk about this research look at the decline of coal mining, the impact on the opioid overdose mortality in rural Central Appalachia. Yeah, so it just kind of highlights the importance of the just energy transition from the lens of the opioid overdose. So on January 27th, 2021, which last year, just several days after President Biden took office, he established a interagency working group. As you can see on the right, so it is composed of a large number of federal departments and agencies. The working group focuses on the coal and the power plant communities and how to help them to revitalize the economy in those communities. Then in April 2021, the interagent work group published an initial report, and in the report, they identifies 25 what they call the priority energy communities. So those are the communities that have relied on the coal and the coal power plants, and those communities have been or will be continue to be negatively impacted by the energy transition. So if you look at this, so I list these 25 priority energy communities. So if you look at this the list, the top 4, right? So I have West Virginia, East Kentucky, West Virginia, and then southern West Virginia. So those all in the Central Appalachia, those coal communities. And in fact, 9 out of these 25 priority energy communities are in the Central Appalachia, which is the geographic focus of this research. So this graph on the left shows you the Central Appalachia. So it covers the whole state of West Virginia and then also have a large portion of Kentucky, Tennessee, and Virginia. So this is Central Appalachia. It's a region that mostly rural, and also, as you can see, the coal mining is the major industry there. Then on the right, I show the coal mining in the past 2 decades. So between 2001 and 2017, then as you can see, so this both shows the showing you the coal production and also the coal employment. So as you can see, in the 4th decade of 21st century, the coal production is more or less stable, kind of all the way on until 2009. The coal production was more or less kind of stable. The coal employment actually was a little bit rising. And again, because the productivity, if you are familiar with the coal mining, then the productivity was down because it's more difficult to mine coal. So the coal employment actually increased in the 4th decade, and then as you can see in the second decade, from 2010 and this is 2010 and 2017. So you see a dramatic decline, both in terms of the coal production and also the coal employment. So it's in most of cases, on average, it's more than 50% of decline. And most of us know what are the causes. So because all this most due to the decrease in the coal-based electricity, because of the cheap or the less expensive, or the price of natural gas went down, and also there are a lot of renewables and renewable energies enter the market. So that's kind of the again, this is kind of from the econometrics perspective, is an exogenous shock to the coal mining. So the question here, we are trying to really look at what is the impact of this dramatic decline in the coal mining in the last decades on the well-being of these rural coal communities in Central Appalachia. So we are from the perspective or the lens of opioid use disorder and opioid overdose death in those communities. So we know that we have a what we call an opioid crisis in the United States overall. So this graph shows you between 1999 and 2017. So on average, so this is a national average. So the overdose death rate is more than so increase from fewer than 10 deaths per 1,000. I think this is 10,000, 100,000 increase to more than 40. So you can say this is a significant increase. This is the national data on average. Now, so people talk about 3 waves of the opioid crisis in the United States. So before 2010, then the overdose deaths is mostly caused by the prescription opioid. So that's the first wave. And then you see a dramatic increase in deaths caused by the heroin. So this is an illicit drug. And then more recently, you see this 3rd wave, which mostly caused by the synthetic opioid like the fentanyl. So both heroin and the fentanyl are illicit drugs. So just a little bit kind of background in opioid crisis in the United States. So when people talk about the major causes, the major reasons for why we got here to have this opioid crisis, there are two major kind of reasons. So from the supply side of the drug, so people talk about what they call the prevalence of drug. So again, the idea is starting from the 1999, so we have the overprescription of the prescription painkiller, which are the opioids, that was pushed by the pharmaceutical company like Pharma, right? And then we have illicit drugs like heroin and fentanyl come in from the illicit market. So because all these different drugs, they are here, so we have the prevalence of drug from the supply side. From the demand side, we have people talk about what they call the disease of despair, or kind of more generally, the disease of despair. So the idea is with all this manufacturing jobs outsourcing overseas, and then we had this dramatic decline in the industry, manufacturing, so which caused the social economics disruption and difficulties, and then people turn to drug. So that's the kind of from the demand side, talking about the disease of despair. Now, if you think the US has a opioid epidemic crisis, so this graph shows you on average, the national death rate is about 10 deaths per 100,000 people. But if you look at the rural central population, that's double, 20. If you look at the rural, the coal communities in the rural central population, so that's 30. So compared to the national average, the rural coal communities in central population, that's triple, 3 times the national average. So if you think we'll have really bad opioid crisis in the United States, then the rural central population, those coal community that are much worse. Okay, so we are trying to figure out what is this impact of the coal decline and the opioid overdose deaths in those communities in central Appalachia. If you think about the impacts of the coal decline on opioid use disorder, then so first kind of the idea you have in mind is disease of despair, right? So this is the same idea that when the economy went down, then people turn to drug, people feel despair, then they turn to drug. So in this case, then when the coal decline should have increased the drug overdose. But on the other hand, think about the coal mining. Coal mining is a very kind of physically demanding, right? So you have a lot of, at least you are more likely, if you are a coal miner, then you are more likely to have a on-job injury or pain. So then you go to doctor, then you got prescribed with the painkiller, opioid prescription drugs. And then there are two things might happen. One is those coal miners could become addicted. But more importantly, so if you have all these drugs, and those drugs, if they are diverted across the community, so you will have all the prevalence of the drug in the communities, right? So so this is what we'll talk about, the coal mine to drug pipeline. So people got injured or got hurt, got injured on job, and then they got a prescription drug, and then you have the diversion of the drug, so you have this prevalence of drug. Now, if this coal mine to drug pipeline dominates, then you would think that when the coal mine decline, then you have fewer workers, right? So it actually improve this or or mitigate or reduce the overdose problem. So as you can see, these two mechanisms or these two channels, they are competing. So we have to figure out which one dominates and what is the overall effects. So indeed, there's one paper recently, just almost at the same time as our study. This is NBER kind of working paper. So they kind of look at the same problem, but they just use one variable. So they look at the correlation between the co-labor, the co-employment, the ratio of the co-employment, and the overdose death rate. What they find is they find a positive relationship between the share of co-minor and the opioid overdose deaths. So this seems, so their conclusion is then it seems the co-mine to drug pipeline dominates. So which means when co decline, then actually the overdose death rate went down. So their story or their conclusion is the decline in co-mining in the United States may have a positive spillover in the form of reduced mortality from opioid use. So this is their kind of finding, but there are a number of kind of issues in this paper. So we want to kind of, but I want to send this paper to show you that what the literature kind of is doing. Okay, so what we did is we first conducted a kind of a quantitative study. So we conducted 14 kind of semi-structured interviews. So we talked to in Logan County, West Virginia, which is one of the major coal counties in West Virginia, which experienced dramatic coal decline. So we talked to, we in total we had 14 interviews. So these are all the stakeholders. So what I list here are all the stakeholders that we interviewed with. So you can, as you can see, they have emergency service people, the healthcare and the substance abuse counseling, rehabilitation, outreach, education, and also we have people in the coal industry, and also we have people in the economic development. So that's and then during these interviews, so one theme that comes up over and over again is people talk about the ripple effects of coal production. So the idea is the coal mining, when coal mining declines, then all the business, the local business along the value chain of the coal mining, right? Because you have a lot of local business they are servicing the coal company, all the way to the local business that are servicing the community. So all these other, so they are talking about these ripple effects of the coal decline, particularly associated with the coal production. So they establish a lower income, decreasing job opportunities, fewer social service, and a growing sense of hopelessness within the community, particularly among the working age population. So this is like the ripple effects of the coal production decline they talk about. We asked them about the coal mining to drug pipeline, and then they think there's something there. But most of the people, they think the relationship between co-employment, workplace injury, and opioid misuse is tangential, so it's kind of minor at most. So that's kind of the insights we got from those interviews. Then based on these interviews, so we conducted the quantitative analysis. So again, the idea is people talking about all these ripple effects of co-production versus the coal mine to drug pipeline. So the key idea in the empirical study is we say, why don't we separate these two, right? So we use the co-production to proxy this death of dispatch channel, the mechanism. Again, because of this ripple effects of co-production, people talk about along this value chain of the co-production. And then we separate this from the co-employment, right? And the co-employment, that's most about a co-worker, how many workers you have in the industry. So this, we think it might be used to proxy for the coal miner to drug pipeline. So we want to put both variables here, and one using co-production to proxy for the death of despair channel, and then we use the co-employment to proxy for the coal mine to drug pipeline. So we separate these two. And on the right, as you can see, so people, the first kind of response that people have is, gee, these two variables are highly correlated, right? Because the co-production and the co-employment, they're going side by side. But fortunately, still there's some variation. So this graph shows you on the right, shows you this is when look at the change in the co-production on the vertical axis, and the change in the co-employment on the horizontal axis. So this is the 48 counties that in the sample. So as you can see, even though it is highly correlated, but still there are some variations. So some counties, they have more co-production decline than the co-employment reduction, and vice versa. And again, fortunately, empirically, we are able to separate the effects of these two variables. And one thing I also want to highlight is, as I said, all these co-decline, both the decline in the co-production and the co-employment, they're more or less exogenous, right? Because it's just some negative shock by the natural gas and also by the renewables. Okay, so this is a kind of more specific kind of economics specification. So we have 48 rural coal counties in Central Appalachia, and then we have this panel data. So this is county level panel data. So we look at we have all the data on the co-production, employment, and also overdose deaths, and also socioeconomics variables as a control. So this is kind of main results. So if look at the column 1, so in the column 1 and column 2, we just use one variable. So either co-production or co-employment. So in this case, we don't try to separate these two, right? So we just look at the overall correlation or relationship between the coal mining and the overdose death rate in those communities. So as you can see, this is negative, which means when coal mining goes up, then overdose death rate goes down. Or inversely, when coal mining went down, then overdose death rates went up. Right. So again, so this kind of overall, as you can see, there's a negative correlation, or if we think about a causal, so there's a negative impact of the coal mining on the overdose. So just look at these two results in the column 1 and 2, then it seems that the death of despair dominates, right, overall, because we do say this a negative kind of correlation between coal mining and overdose deaths. Then in the column 3 throughout 7, so we put these two variables together in the regulations. So as you can see, the co-production coefficient is still significant. So we have when co-production went down, then the overdose death rate goes up, right? So this is a very strong evidence on the death of despair when the co-production went down, and then we have these ripple effects of co-production, and then the overdose death rates went up. If we look at, but on the other hand, the co-employment, even though it's positive, right? So meaning but it's insignificant, which means, again, this is very much consistent with the interviews. So the coal mine to the drug pipelines, they are minor issue, or the minor channel is not significant, even though it's positive. Okay, so that's the result. So again, this result basically shows you or suggests that in this rural community, at least in this past decades, between 2010 and 2017, then the deaths of despair dominate. And we have when the coal and the ripple effects of the coal production on the community dominates. So these are just this table just show you if we separate the death rate from among different groups. So we have male and female. We have different age group. So as you can see, or we look at different opioids prescription versus illicit opioids. So all the results are more or less very robust. As you can see here, the only insignificant is when look at the retired people, then there's not much effects. So we also conduct a lot of robust check, and the results are, when look at different sample and so on, the results are robust. This is kind of the last table I wanted to show you. This basically kind of evidence on the ripple effects of co-production. So what we have here is column 1. We look at the impact of the co-production and co-employment on the local business. So this is the number of service establishment in those counties at county level. These are kind of service, these are finance, entertainment, and so those kind of a service establishment. So as you can see, the co-production is positively correlated or has positive effects on the establishment. Right? So again, this base says when the co-production goes up, then the local business boom, and then when co-production went down, then the local business went down. So that's, again, this is a direct kind of evidence on the ripple effects of the co-production. On the other hand, the co-employment is not significant. On column 2, so when we look at the opioid prescription drug rate, so if we have this coal mine to drug pipeline, then we would think the co-employment and the opioid prescription should be positively correlated, but which, even though it's positive, but not significant. So again, this basically suggests that at least during this period between 2010 and 2017, then the coal mine to drug kind of pipeline is minor issue. And then in column 4, so this is kind of our baseline results. I repeat here. And then in column 4, so I look at the kind of the relationship between the local business and opioid prescription rate and overdose death rate. So as you can see, the local business and overdose death rate is negatively correlated, and opioid prescription rate and overdose is positive correlated. Now, in column 5, so I put the co-production and the co-employment here. So as you can see, then the service, the local business effects goes away. So this, but the co-production is still significantly negatively correlated with overdose death rate. So this basically suggests the service, the local business is a kind of mediator, right? So the co-production impact the overdose through those, and is one of the local ripple effects. So that's kind of a further evidence that on the ripple effects of the coal decline. So that's basically the kind of the results. So the results shows this research basically shows you that it's very important for us to focus on a just energy transition. The idea is when we have this energy transition, then there will be or have been and there have been and will be negative impacts on certain communities. So we have to also think about how to help them, those communities. From the opioid crisis perspective, so this research shows you if we want to address or mitigate opioid crisis, then we have to go beyond all this health kind of measure, right? The intervention. So we have to think about how we can intervene. So this is what we call the social determinants of the opioid use disorder. So we have to, in addition to think about how to prevent treating those people with OUD, we have to think about how we can intervene to improve the social economics kind of conditions, the social economic environment of those communities, including the economic development and also job training and social service and so on. I think that's all I have. So I thank you for your attention, and then I look forward to your comments and the questions. So I will stop sharing.
You have somebody that has raised their hand. Do you want me to unmute them so that they can ask a question?
Sure, sure.
Okay. This is from Muhammad Islam.
Can you hear me?
Yes.
Yes, I can. Go ahead.
So first of all, thank you, Professor Jan, for your thoughtful presentation. My name is Muhammad Islam, and I'm a PhD candidate in natural resource economics at West Virginia University. And actually, I'm writing my dissertation essay on the same area, but I'm using different model. So my question is, so in your presentation, you acknowledged the coal mining to drug pipeline effect. And so my question is, why did not you include 2000 to 2010 data period? Because I know for 2000 to 2010 data is available for both opioid deaths and coal mining activities. That is my first question. And the second question, based on your empirical results, I saw that you got the negative relationship between coal mining activities and the opioid deaths. So do you think that increasing coal mining activities can reduce opioid overdose deaths? So that is that is my question. Thank you.
Okay. Yeah, I think those both questions are great. So regarding the first one, there are a couple reasons for me or for this research to just focus on the 2010 and to 2017. So I think the most important reason that we focus on this just the second decade is well, there is a kind of a significant policy kind of change in terms of the prescription drug management, right? So I'm sure that you know that it's called a PDMD, right? So this is across all the states, they start to kind of restrict the prescription drug, the opioids, and before 2010, then that was not the case. So with this kind of change policy, so particularly when think about the prevalence of drugs, so might be different. And actually, this is one reason that we think one possible reason that why in this study period we don't say the drug the combined to drug pipeline dominated, because again because all these prescription drug kind of policy change. So that's kind of reason we wanted to separate, because these are different kind of policy regimes. And the second reason is, if you look at what I showed you, the co-production. So between 2010 and between 2000 and 2010, there's not much kind of variation from 1 year to others. It's more or less constant. And that's also the other reason we think we want to just focus on this period that experienced dramatic code decline. So that's kind of the kind of two major reasons for why we focus on this period. The second one, so you are, if I understand correctly, so you are talking about, so right now the coal mine can increase, right? They start to go up. So whether then we will have a reverse or kind of reduce the overdose. Isn't this the question?
Yeah, so my question is, like, from 2000 to 2010, the coal mining was increasing, but at that time period, I mean, opioid crisis, opioid deaths was still rising during that period. So why didn't you consider this time period? That's my question. And,
yeah.
And I mean, if we increase the coal mining activities, like if we don't reduce the coal mining, do you think the opioid crisis will be solved in the region?
Again, we don't know. I think this is a really good question, because as I said, so right now the coal mining, they start to go up, right? Because of all this, the natural gas price goes, on this energy price. Yeah. So actually, this is a very interesting question, because we don't know whether when the coal mining started to reverse this decline trend, then whether we have a immediate reverse or kind of improvement in the opioid problem, or could it be this problem could be more sticky, right? So even we just have temporary kind of recovery of the coal mining, whether it help or you reduce the overdose deaths. This is something that we need to have data to look at. So again, we don't know whether this is kind of sticky or it's more kind of immediate effects.
Thank you.
Yeah, but really good question. Are there any other questions?
I think that may be it. Would you like me, do you want to say some closing words?
Yeah, so thanks. I say there are about 15. Yeah, so thanks for your coming and your attention. I think this is it's an important kind of research questions, how we can think about this a just energy transition. So so I definitely look forward to more discussion. If you have any questions or comments offline, then you can just send me email. Let me put my email here. So it's zleipsu@edu. So my name is Zhenlei at Penn State. So thanks again.
IAEE wishes to thank Professor Zhenlei for an outstanding webinar. This webinar will be available on IAEE's website for future download. If you're not a member of IAEE, we welcome you to join by visiting www.iaee.org. We thank you for attending, and I officially close this webinar.
Okay, thanks again. Thanks, Rebecca.
You're very welcome.
For this opportunity. Thank you.